process. The RFP is a competitive arena where nonprofit and for-profit and government agencies can apply to provide services for the children and families of Broward County. And we use source experts from our community leaders, community stakeholders, to actually come together and review those proposals, interview potential applicants for the RFP process, and then they make recommendations to the council on funding awards. And by doing that, we balance the knowledge of the community in the area of services that we're looking to serve. So in this instance, we used experts in child abuse, child prevention, and parenting experts in order to make those decisions. And we've continued that process to this day. The Children's Services Council has always had a very collaborative approach, both to funding decisions, programmatic decisions, and as part of the driving force, we rely on the Children's Strategic Plan and its 13 subcommittees. And those committees are comprised of source experts in the community, and each committee has their own focus, like delinquency diversion programs, or independent living programs for youth aging out of foster care, or academic remediation for high school students. So they run the gamut, and those committees from the ground up elevate what the needs are of the community at that particular point in time. And those recommendations go to the council, and they turn those into their annual goals and objectives. So every year since inception, the council comes together and they look at the information that comes from the community, and from that information, they hone it down to about 11 priority areas, and then funding decisions bubble up from the underpinnings of each of those goal areas. We take our fiduciary responsibility to the taxpayers very, very seriously. Like I said, all of our procurement decisions are in the sunshine, they are transparent, and they are not staff-driven. They are really driven by community stakeholders. It's important for us to make sure that our community knows the good work that is being done every day under the funding of the council, and that the taxpayers feel confident about the changes in their community that are really making a difference, whether it's reducing crime, whether it's reducing re-abuse rates for children, whether it's improving the academic and testing scores of low-income children struggling in school. All of those things we can report. We put that together annually, and anyone can call me anytime, and I'm happy to walk them through it.
And now I'm joined by Dr. Paula Thatchy, Director of the Broward County Health Department and Chair of the Children's Services Council. Hi, Paula. Thanks for coming.
Hi, Cindy. Thank you so much for having me.
It's been great having you as chair this last year, though I know it was a little daunting for you being the first chair that was not one of the founding council members. But you've taken the reins quite well. You came in at a time of great economic distress in the community, and you saw us approach the budget in a way that I know you expressed a lot of excitement about. Yeah.
Well, the strength and the impact of the Broward County Children's Services Council really comes from its ability to form and maintain very strong community partnerships, and really to bring together our very diverse community to invest in the futures of children, and to allow children in Broward County to realize their hopes and dreams and to realize their full potential, but to do so in a way that's very efficient, very effective, and really exemplifies values that I hold dear of accountability and transparency.
And you've really pushed that through us, and I know one of the things that you've been proud of is the results-based accountability and bringing that into the community. You want to talk a little bit about that?
The Broward County Children's Services Council has really been a leader with respect to implementing results-based accountability, not just through the work of the Children's Services Council, but also by building the capacity of our partner agencies and our funded agencies to really be accountable, to make sure that our programs and services are as effective as possible and that they're actually influencing community-level health status indicators and other indicators of children's well-being in our community. So when we go through our budget process, we're actually able to look at the performance of each of our individual programs and each of our individual provider agencies. We're able to look at outcome measures that have been set for each of the programs, how many children are being affected, where those children live, who we're reaching in our community, and the changes that we're making at a community level in children's lives every day.
And as a pediatrician and the director of the health department, I know you've been very concerned about the work that we've done with respect to helping with children's health. Some of those, most of which we partner on.
Well, children's health is a very important part of the Children's Strategic Plan. And the Broward County Children's Services Council has done a lot with respect to supporting efforts to maximize children's health in our community. For example, supporting kid care outreach, supporting school health, supporting drowning prevention, fetal and infant mortality review, efforts to combat childhood obesity, and the list just goes on and on.
And you are a tremendous partner there, and obviously provide some of the actual services that we're talking about. We are always trying to maximize those resources, the shrinking revenue from the state, the shrinking revenue locally, and so that ability to partner on things like kid care outreach and H1N1. We'll talk about how we work together on that one.
Well, with respect to the H1N1 pandemic, we know that we needed to address the most vulnerable members of our community, including children and pregnant women. And so the Broward County Health Department led a community effort to make sure that as many folks were vaccinated as possible who wanted to be vaccinated. And Children's Services Council was a very important partner in allowing us to have a point of dispensing for H1N1 vaccine at our wonderful Silver LEED certified building, and to really have that be a center for folks in the community to come and get vaccinated.
That was very exciting. I think it happened a month after we moved into the building, so it was really quite an amazing feat on my staff's part, and also a wonderful partnership with the health department.
Well, that really exemplifies the strength of the Broward County Children's Services Council to bring together the community and to leverage resources through partnership, and to use those resources in an evidence-based, efficient, effective, accountable, and transparent way. And so I'm so proud to be the chair of the Children's Services Council of Broward County and a member since 2008.
And we're so happy to have you.
Thank you.
Thanks so much, Paula. It's been great.
Thank you, Cindy, for your leadership.
My name is Sandra Bernard Bastian. I'm the Director of Public Affairs and Organizational Development of the Children's Services Council. What does that mean? It means that I have responsibility for public affairs, government affairs, community outreach, public education about the role and mission of the CSC, and also training and capacity building of organizations who serve children and families in Broward County. What is probably not known is that, or has been forgotten, is that the first day that the building and the organization actually started operating was the 17th of September, which was 6 days after the most horrible, tragic incident took place in New York on the 11th of September. So I think that most of us came into the job, many a little shell-shocked, realizing that our world had changed, the world that we knew in the United States of America. We came in, I think the incident strengthened our belief in the role that we had to play in the future of children in Broward County. So for my department in particular, I don't want to say my department as if I have fiefdom, but for public affairs and organizational development, we started immediately, and when I say we, at the time it was only me in the department, started immediately thinking what would be our first task in Broward County. And one of the first tasks really was to produce the Broward Family Resource Guide, followed swiftly by the annual report. That set the tone of providing resources, not money only, but information as a form of resource for the community of Broward County. And that has set the tone, and we've continued to do that throughout the 10 years that we've been at the CSC. I'm lucky that I work with an incredible team who has made certain that when folks think about, oh my God, we have an issue with children, who do we turn to? They think of the CSC as an honest broker, and they look to us for direction and leadership. And we have been more than happy as an organization to do that. And we are very, very proud of that role in the community. It's important to know that if you're listening to me, you know that I have an accent. I am originally from the Caribbean. The number of people who live in Broward County who are from the Caribbean, that number continues to grow with each census. The number of people from different countries who live in our county continues to grow with each census. As a result, the Children's Services Council, that resource guide that I spoke about, that very first resource guide was in Spanish and English. The second one was Spanish, English, and Creole. By the fourth one, it was Spanish, English, Creole, and Portuguese. The role that we play in a public awareness around the earned income tax credit, that has also helped us to identify growing pockets of immigrants, new immigrants to Broward County. We know, for instance, that in the north part of the county, in Pompano, in Coral Springs, that there's quite a huge Brazilian population. We've done quite a bit of outreach to them. We work with Hispanic Unity all over the county to reach out to that Hispanic population. We work with MDEI, Minority Development and Empowerment, to reach out to the ever-growing Haitian and Creole speaking population. So the CSC has been astute and very aggressive in going out and making forays into those communities. And when we reach into those various communities, we have different tools. There is no better tool than that face-to-face. So we do a lot of community events, and we are able to speak to the various members of the public in their language of choice. We have members of staff who can speak several languages, and we, whatever you're comfortable with, we're willing to try. Not only do we provide public education in those sorts of arenas, but remember, we're also very much involved in the area of capacity building. So when we say capacity building, we are looking for any way that we can use to make sure that an agency who's serving children, no matter how small, that they can do so in a more effective manner, a more efficient manner. So the CSC provides hundreds of trainings every year. I think last year we trained 3,000 participants in various topics. We also provide a quarterly forum for smaller agencies to network. We encourage partnerships. We provide technical assistance, not only by staff who themselves go out to agencies and sort of help them in areas where they would have an area of expertise, not only in those areas where they themselves would have those that expertise, but we also work we provide technical assistance through a third party, through a consultant who will go out and work with those agencies to help them come together with some sort of strategic plan, to help them work on a marketing plan, to help them plan for the future so that they can become more effective. Approximately 9 years ago, there was an article, I believe, in one of the local newspapers, and it said that 85,000 families in Broward County who were eligible for the Earned Income Tax Credit were not accessing it. The IRS identified that folks just did not know of the existence of the Earned Income Tax Credit. And the CSC became involved first in just spreading an awareness about the credit's existence. And then more and more, we've become involved in providing volunteer income tax assistance. Working with partners, for instance, like Volunteer Broward, we can identify volunteers who would like to provide free tax preparation for low-income families. This has had a tremendous impact on Broward County because our efforts, we can trace that our efforts have brought an additional $153 million to Broward County over the past 8 years. As a department, we are very, very proud of that because this is a project that surfaced within the department. This is a project that we have coordinated as a department. This is a project that we have brought all sorts of various partners to the table. So, you know, I'm very proud, my team and I are very, very proud of our involvement in this particular area. One thing I know is that one is never really certain of what the future holds. But certainly in the next 4 years, we have to go back to the voters and be re-elected. And we know that the voters, once they are aware of how we do what we do, they love us. They think that this is money well spent. They know that we are a lean, efficient government. I like to think that we are government well run. And once we get over that hurdle of being re-elected, we will continue to have forays into areas that we can't possibly think of. We will have an impact. We will continue to make a positive impact on children's lives.
And now I'm joined by Josie Bacayao, President and CEO of Hispanic Unity. Hi, Josie.
Hi, Cindy.
Thank you for being